Come in.
Hi, my name's Paula. I'm going to be your nurse today.
Oh, hi.
How are you today?
Well, I've been better.
What do you mean by you've been better?
Well, I think lately I've just been having a lot of abdominal pain. I feel like it's been more to my right side. And just the other day I started feeling nauseous and today I actually threw up a couple of times.
Okay.
Yeah.
I see. Where has your abdominal pain been?
Like over here?
Mm-hmm.
Yeah.
Is there anything that helps relieve that pain?
It's usually when I'm in bed and I can just ball myself up between everything. That kind of makes it feel a little bit better.
Okay, so you're saying it's like when you get in what you call the fetal position?
Yeah. Yeah.
So, yeah.
Yeah.
What number would you give your pain on a scale of 0 to 10, 10 being the worst?
I just it's like a 7 or 8.
7 or 8?
Yeah.
Wow.
Yeah.
Well, there's a lot of pain. Okay.
Mm-hmm.
Well, I'm going to just do a quick assessment.
Okay.
It's going to be more focused on your abdomen since you're telling me that's where your pain is.
Okay.
Okay. Do you mind laying down?
Sure.
Okay. Alrighty. So I'm going to start off by just listening to your belly, okay?
Okay.
So I'm just listening for bowel sounds, okay?
Mm-hmm.
So abnormal bowel sounds would be if there's no sounds,
Okay.
no gurgling sounds. So your abdomen, literally, usually you're supposed to hear gurgling sounds.
Okay.
Okay. So I hear it's really faint, but there are sounds. Okay. So next, I'm just gonna go ahead and what we say palpate, as in kind of massage your belly.
Okay.
Just to see if there's any spots that are okay. All right. So I'm just feeling around. You tell me if it hurts, okay?
Okay.
Okay. So I'm just gonna do this test, what we call McBurney's point, where we just push in.
Ah.
Oh, does it hurt there?
Yeah, it does.
Okay. So it hurts on you down there.
Mm-hmm.
Okay. Okay. Alrighty. So go ahead and sit back up, Gabe. Okay. So we're still waiting for your test to come back, your test results. But what they are going to do is get some blood work. Their lab, the phlebotomist is going to come in, get your blood work to get what we call blood cultures, and they're going to do what they call a complete blood count, which is a CBC. They're just looking to make sure your white blood count isn't elevated, because if it is elevated, that means you have an infection.
Oh, okay.
Yeah. So besides that, I did see they did get a CAT scan down in the ED. Did the doctor talk to you about those results?
Not yet. I'm still waiting for them, but
Okay.
yeah.
Okay. So I'm not a doctor, so I really can't diagnose you, but I have a feeling it might have to do with your appendix.
Okay.
Yeah, but we have to see what the results come back. Just based off what you're telling me and all those things, it seems that you might have appendicitis, especially since it's on your right lower side that it's hurting.
Yeah. So what are we gonna do? Is there do I have to get surgery? I know, or I might have to get surgery, or is there something else we have to do first?
Okay. So let me just explain to you a little bit what appendicitis is.
Okay.
So appendicitis, is your appendix. So pretty much with appendicitis, it's when it becomes inflamed, which is infected, which is not good, because if it becomes infected, oftentimes it can burst. Not that,
yeah.
I know that's not good, but so it can, and that's what we're trying to prevent. So I'm glad you came in, and we're gonna get this treated. So yeah, it can get infected, and it can get what we call pus in it. And if it bursts, it'll get into your other abdominal organs, which is not good, because that can lead to sepsis, and sepsis is just like a blood infection.
Okay.
Yeah. So you were mentioning what we're gonna do. So we're waiting on the test results to come back. So your CT of your abdomen, that's what came back. They did an abdominal ultrasound, so we're waiting for those results to come back. Besides that, then the doctor will come up, talk to you about it, and say, here's what we're going to do. For now, we're going to put you on antibiotics.
Okay.
Because we're going to conservatively treat that while we wait. That way you're just not sitting there, you know.
Yeah.
Yeah, so you might get penicillin. It all depends on what the doctor wants to order.
Okay.
Do you have any allergies?
Not that I know of.
Okay,
Yeah.
perfect. So yes, so we're gonna do that. What else? IV fluid. So we had to keep you hydrated. Yeah, we're gonna keep you hydrated. So IV team's gonna come start an IV. They start you on fluids. They're gonna start you on antibiotics. The doctor also, I saw he ordered that he wants you to be NPO.
Okay.
That means no food, water, drinks, nothing, because they want your bowels to rest.
Okay.
Okay?
Alright.
Yeah. Do you have any other questions for me, Gabe?
No, I think that's everything. Thank you.
Are you sure?
Yeah.
Awesome. Well, if you have any questions that you come up with while you're, just let me know, and
Okay.
I'll gladly answer them, okay?
Okay, thank you.
Okay, you have a nice day, Gabe,
You
okay?
too.